health, because the People for Health, a national health advocacy team, is demanding government provide details on the sustainable funding for HIV prevention announced at the 2018 National HIV and AIDS Research Conference, NACON, in Accra. The group, a subsidiary of SEND Ghana, has serious concerns about the lack of details provided in the statement, such as the timeline for the release of the funds and specific plans for allocations and sustainability. President Akufo-Addo assured Ghanaians government will provide funds for the HN activities to reduce the rate of HIV infections in the country. Now, Parliament enacted the National HIV and AIDS Funds Act 938 in 2016, which established that Section 22 of that act states that sources of money for the fund include monies approved by Parliament for the fund and grants, donations, gifts, and other voluntary contributions. Now, joining me in the studio to discuss this is the Civil Society Advisor to the People for Health Project, Munkaila Adamu. Good afternoon to you, and good to see you on the polls. So why do you want the details published?
Yes, we want government to come out clearly to tell us what the fund, where is the fund going to be gotten from. Like you indicated, if you take the HIV Act, Act 938, it was passed in 2016. In the Act, it is stipulated clearly that there should be HIV funding. 2 years down the lane, nothing has happened. Just last month, during the conference, the president comes again and tells us that they are going to provide fund. Is it the same fund that is stipulated in the HIV Act, or is it a different fund? The government should be clear on it. What are the sources of funding? Where are we going to get the funding from? How sustainable is that source of funding? How can an NGO or people who want to help in the fight of HIV access those funds? These are the questions that we think that the president should come out clearly and answer to Ghanaians so that we know and monitor the implementation of the fund.
Well, why has it become necessary for you to demand for these details? It
has become necessary because if you look at Ghana as a whole, HIV is becoming an issue. Between 2010 and then 2016, new infection has increased by 21% compared to a global picture, which has rather seen a decline. And if you take the youth between 15 to 24 years, it's about 45%. So if nothing is done, then it means that our future leaders that will be leading this country will have issue of HIV to deal with. You see, what is making it worse is that over the years, consistently, HIV has been financed by donor funding. Government budgetary allocation to HIV, instead of the disease going up, is rather decreasing. If you take between 2014 and then 2016, the budgetary allocation to the National AIDS Commission has reduced by 68%. So if at the same time, if you consider HIV among pregnant women, it has actually increased from 1.4 to 2.4% in 2016. So it means that we have to do something as a nation. Currently, if you go to the district level, the only funds available for HIV is the 0.5% for of the District Assembly Common Fund, which is used to finance HIV programs. And that is less than 10,000 Ghana cedis a year. What can 10,000 Ghana cedis a year do at a district level to fight HIV? That is why we are calling on the government to come out clearly and try, and more to the point, very soon the donor funding will not be there again. How are we going to sustain the gains that we've made? Are we going to still rely on the District Assembly Common Fund or the reduction in budgetary allocation? So that is why we are asking government to come out clearly, because the Act mandates government to set up the fund so that we can have enough resources to fight the disease.
I get your point, if we must all be worried because the numbers are increasing. But what do you think is accounting for the increase in numbers and actually a decrease in funding?
Yeah, because like I indicated clearly, it was actually sponsored most at especially from 2012 to 2014. Basically, it was over 90% donor funding. So almost all the resources were coming from outside.
Okay.
Now there's competing demands, issues of refugees. People are now taking measures to deal with their own fight their own domestic issues.
Okay.
So funding has actually reduced globally, which means that countries should make effort to increase domestic funding for HIV programs. If you take countries like Zambia, Togo, and then Kenya, they've increased their funding for HIV. In 2004, $1.5 billion was used. South Africa used $1.5 billion to finance HIV programs.
Okay.
In 2017, government allocation to the national HIV committee was just 9 million. What can that be used for? Which includes salaries.
Okay.
So that is why we are calling on government to do something.
But it's even sad that as the money or funding is decreasing, we are rather seeing some interesting figures. I mean, the figures rising.
Exactly.
And I'm asking what could be accounting for the rising figures?
It's because there's no funding for HIV program. When was the last time you saw HIV advert on TV or telly? People are now relaxed. Nobody is actually at the district level, nothing is happening. We think that we are okay. And now there's increase. I mean, because people are now being encouraged to go in for the test. And once they are testing, the numbers are coming up. And these people need to be put on these antiretroviral drugs, which also require funding.
Okay.
So if we don't make enough provision, very soon the antiretroviral that we are currently receiving is from donor fund. It's just free. Very soon, this thing is not going to happen. So how are we going to finance it? Even those who are HIV positive, how are they going to have access to antiretroviral drugs? So that is why we are calling on the government to do something about it.
I know People for Health, you do a lot of advocacy, and you deal with some of these HIV patients. And what are the challenges you face on the ground? And so much so that you really need the act or the fund to be made active so that you can benefit from.
Yeah, like you indicated, currently we have over 250,000 people living with HIV, and they need to be put on treatment. And this treatment very soon is not going to be free. We have to fund those treatments. So if people are not getting their medication, it means that at the end of the day, they are going to affect others. Currently, the nation has embarked on what we call 90-90-90 strategy. That is, at least 90% of people should know their HIV status. And those who tested positive, 90% of that should be put on the antiretroviral drug. And we believe if that is done, 90% of them will achieve what we call viral suppression. When you achieve viral suppression, what it means is that at that point in time, even if you have unprotected sex with somebody, the person is not likely to get the HIV virus. And that is where we are moving. And with this kind of pace, we believe that by the year 2030, HIV should be eliminated from Ghana. But here is the case in our situation. The whole world is trying to eliminate the disease by the year 2030. They are putting in enough resources. And yet, we are rather decreasing our resources.
Okay.
And the disease keep on increasing.
Okay.
Yeah. Now, you talk about challenges PLs are facing. Nowadays, like as indicated, one of the antiretroviral drug is basically free. But before you are put on this antiretroviral drug, you have to go through some tests. And that is where the challenge is. Most of them cannot afford the test. And because of that, even though they know they are positive, they are not put on the drug. So these have been the major challenges that the PLs themselves have. And the other thing has to do with stigma and discrimination, as you know. People don't want to be associated with HIV and AIDS. If it's diabetes, fine. But if the person is HIV positive, that is a different thing. Because of this, people don't want to even come out to go and do the test. But now, HIV is not like in those days that, Once a person gets the disease, that's the end of you. This time you can live your normal life. Provided you take your antiretroviral drug, you are supposed to do whatever you are supposed to be doing.
Okay.
Yeah.
So, of course, based on these reasons, you want government to, be up and doing with this fund we're talking about. So, how do you intend to push government to, get your request?
Yeah, currently we started the campaign last year, trying to get the government to increase the District Assembly Common Fund, which is currently 0.5%, to at least 2%. If that is done, then it means that the assemblies will have enough resources so that they can start tackling some of these issues at the grassroots level. We are also urging the assemblies with HIV prevalence rate more than 5% to at least devote some percentage of their internally generated fund to support the 0.5 that is coming from the district assembly, so that at the end of the day we can start doing this. So we've started engaging the assemblies, and we also want government to take up this fight seriously, because we can't sit down and wait, so that when it gets to the levels that the South African countries experience, then we'll start panicking here and there and taking, so that is why we are asking government to do that. If government refuses to listen to us, we will continue advocating. There's nothing more we can do than to advocate. We'll still engage, continue engaging government.
Okay, but so far, have you engaged any of the Ministry of Health?
Yes. Currently, we are mobilizing civil society groups to join the campaign, so that if we are able to mobilize enough. Currently, we had some level of collaboration with TUC and others who are coming, other religious groups who are also coming together, so that we can put pressure on Ministry of Health and then Ghana AIDS Commission and the Ghana Health Service to do more about HIV and AIDS.
But you haven't taken that step yet?
We've taken that step. Like I said, we have the relationship with TUC. We had about 2-3 meetings with them. They've agreed to join us in the fight against.
So I'm saying that you've not, gotten to government yet. You've not met the Ministry of Health or Ghana AIDS Commission. You haven't taken that step yet.
We've met Ministry of Health, especially when we launched our report. We invited them to be part of the launch and to know the situation on the ground.
Okay.
We are yet to meet Common Fund Administrator, where the formula for HIV, for the DACF is proposed.
Right.
So that currently, like I said, is 0.5. If something can be done. We've also met some parliamentarians, at least the Parliamentary Select Committee. Some of them were present during the launch, so we've engaged them, and they've all agreed that they will do their best to help us.
Right. So, so the response has been positive.
Yes.
So, one interesting point you made was the fact that people are still stigmatizing. You've been advocating for a long time. How would you rate it? Have we made some gains around that area?
Yeah, in terms of stigmatization, well, it has gone down a bit. But like I said, we need to sustain the campaign. It's not something one-off. You need to keep on reminding people. The person with HIV could be your brother, your sister, your mother. We need to do that. But where are the resources to do that? So that is the issue.
Pretty sad story there. And so Munkaila Adamu is a civil society advisor to the People for Health project, and they are pushing for the AIDS fund to be activated, and also show them the details of that fund, whether we have some money in, whether we are about to have some money in, and what has happened to that fund.
We are even suggesting that if certain percentage of the heritage fund can be devoted to fight against it. What is the use of the fund, heritage, if at the end of the day, those who are supposed to inherit the fund all died before their time? Yes. Can't we do something about it? Can't we use part of our oil money to support the fight against HIV?
Have you made this proposal known to
we've made this proposal at various stages of our engagement with government stakeholders. Yes, correct. We've not gotten any positive response yet.
All right. So wish you all the best in this endeavor, and we hope that government will listen to you and at least grant your request. Thank you very much, Adamu Munkaila. Adamu Munkaila is civil society advisor to the People for Health project. Yes.